Welcome to Professor Sutton from Imperial College London, and to Professor Boon Lim, Clinical Lead for the Imperial Syncope Unit at Hammersmith Hospital, both members of STAR's Medical Advisory Committee. Thank you for joining and for being available for patients.
Good morning, Trudie. Thank you for having us.
Good morning.
Good morning.
Good morning. Boon, how is a diagnosis obtained? Because we hear all too often it can take months, years for someone suffering with syncope to find a diagnosis, or to misdiagnose, very commonly misdiagnosed as epilepsy. So could you just take us through some key steps for patients that are experiencing syncope? What should they expect to be able to obtain a diagnosis?
For whom is the question?
For Professor Lim.
So I think the point that Richard's trying to make is why for whom is this how to make a diagnosis question directed at? Because at patients or at healthcare professionals, and there's a great deal of education that needs to be given to healthcare professionals to help our patients with clear diagnosis of vasovagal syncope that an expert healthcare professional can ascertain in I would say a decent amount of time, not short, which is one of the problems, Trudie, that we'll come back to, but maybe a 10 to 12-minute consultation. Bearing in mind most consultations in primary care, and that is where most patients' first port of call is, lasts anywhere from 8 to 10 minutes to cover one thing and only one thing, when actually the constellation of symptoms that a patient presents with vasovagal syncope, as I explained earlier on, could be chest pain, palpitations, lightheadedness, shortness of breath, nausea and vomiting. Now, if you weren't adept as a healthcare professional at bringing all these symptoms together, you might focus on, for example, the nausea. Now, nausea is a very common pre-syncopal symptom, right? And not every nausea episode translates into syncope or a full faint. You might feel very nauseous whenever your blood pressure is extremely low, and that could be your predominant problem, and you might have only had, say, 2 episodes of syncope in the last 6 months. But the strategy for management and diagnosis in that patient is on the basis that a healthcare professional does understand that these constellation of symptoms can fit within the diagnosis of pre-syncope or syncope. So in order to make a diagnosis, coming back to your question, one must take a good history. And the history is key. And when I give lectures to junior doctors and even senior doctors, I would say the top 3 things in terms of diagnosis is history, history, and history. And to understand the history, the importance of history, and actually the facets of the history that point you towards a clarity of diagnosis is the key thing. Now, not helpful for patients. I mean, what I've said is not necessarily going to be helpful for patients, because you can't help your healthcare professional train in this diagnosis of vasovagal syncope, which is why the STARS checklist is crucially important. When Richard's taking the next question, I'll download that and I'll try and share that on screen. Because if you can come to your GP pre-prepared with a tick box of questions and ideally some blood pressure measurements at the time that you are having the symptoms of syncope or pre-syncope, it would be extremely helpful. Also to know that you've got resources behind you, for example, STARS, with the clarity of explanation that you can bring to your healthcare professional with that checklist, that could also help you help your professional make a clear and accurate diagnosis. But the key components are history, history, history. I would say secondarily, or not secondarily, very importantly as well, sorry, is an ECG. So that is something that you might not be able to do yourself as a patient, but your healthcare professional should be able to read an ECG. And lastly, a blood pressure. So again, when you attend your healthcare professional practice, you should have a blood pressure, ideally one that is taken both sitting and standing. And those are the main principles of how to diagnose syncope.
Thank you. Yes, we developed the STARS blackout checklist with the help of all our medical advisory committee. And it is important that patients complete that to help get a diagnosis. Also, possibly to take a witness with them and a history of how or where or when that they have fainted. I think all those things help as well. As you say, history, history, history. So whatever evidence you can present to your healthcare professional to help them better understand the situation in which you may be fainting.
Trudie, could I interject something?
So I've just downloaded the STARS blackout checklist.
But before you do that, Boon, may I just say that fainting occurs in 40% of people during their lives, at least once. So that makes it very common. The second thing I want to say is that nothing about this is taught in medical schools. When I was at St. Mary's, in the position Boon now is, I held a clinic once a week for syncope, and medical students were allowed to come, but they were not told that it was they were going to see a common thing or be taught how to diagnose it. So most of them never came. When they did come, they were mostly, I think, very impressed with what could be done with the history. But if a subject like this, so common, is not taught in medical school, how can we expect doctors to solve patients' problems when they present with it?
Very, very true, and that's why so many patients are misdiagnosed, or it takes time for them to obtain a diagnosis, which increases their stress, their anxiety, and potentially injury caused by a syncopal attack.
Yes, all of those.
Yeah.